So hello Dr. Mona, how are you doing today?
I'm very good, Abdulhaji. Nice to see you. Welcome to DF Medical Center.
Dr. Mona, can you tell me a bit more about DF Medical Center?
Well, this center actually was established a few years ago, and it is really good center in terms of excellent reputation in the community locally. I have been in this center for years and years, and the service was always very good.
All right, Dr. Mona, do you mind if we go for a walk and I'll ask you a few more questions
Oh
about
yeah,
yourself?
definitely. Actually, the weather looks like lovely today,
Yeah.
apart from being a little bit chilly. But we are very lucky because it's not raining today.
Yeah, that's true. So tell me more about yourself, Dr. Mona.
Okay, my name is Dr. Mona Mubarak. I'm at the moment working in Ireland for the last 15 years. And actually, I've been graduated in Egypt in 1995. So I have been in the field of anesthetics and chronic pain management for the last 25 years. 6 of these years are as a consultant level, and in chronic pain management, which is my fabulous area of interest, for about 7 to 8 years.
So can you tell me a bit more about chronic pain management, about the field, and what inspired you to join this field?
You know what, since I joined the field of anesthesiology, I actually found myself really loving the chronic pain management for one simple fact, which is, in that field, I'm able to relieve pains and to see the rewarding of relief pains among my patients. When you see the patient initially coming and, in tears and not happy with the pain, his quality of life completely deranged, his social life is down, then he gets the treatment and he's in a big doubt that I'm going to help him. After that, and after treatment, in the second visit or first visit after management, I feel like I'm so happy because I can see the big smile on the faces of the patients, and I receive big thank you. Many times I have received flowers, many times I've received, letters. So this is really a rewarding field of specialty.
So what makes you work in a community healthcare service rather than a hospital?
Yeah, see, I have actually some experience in that field. And when I did work as NHS consultant in England, I worked in the hospital setup, and I was in the Royal Orthopaedic Hospital in Birmingham. So I did work in hospital setup for about 20 plus years in my life. But when I joined to Dorset NHS in England, and I worked actually there as a chronic pain consultant for around 3 years in the community health service, I found this is actually the most successful model of pain management, because all we know, hospitals are really full, and actually acute medical emergencies has the priority always to go to the hospital. Not mentioning that, pain is another actually specialty that always undermined in the health service. So when this specialty moved to the community, this was really an exciting and successful experience, because we have spaces to have, do injections for the patients. We have actually more time to speak to the patients, as we are not in an acute setup. And as well, we have, patients can be seen immediately. So I'm thinking that joining and repeating my English experience in the community health service and just moving this experience here to DF Medical Center is really a good practice.
So why did you join DF Medical Center and this area in particular?
Well, I think this, because of course the reputation, the very good reputation of DF Medical Center. So I wanted actually to join the team. As a pain management consultant, I like to work in a team. So in DF Medical Center, we have an excellent physiotherapist. We have a massage person who can help with muscle tension, and we have psychologists. So actually, I'm replicating exactly the same experience in England, when I have all these people in the past, and I have it here again. So adding to this, I want really to help the people locally, so they don't have to travel long distances to go to the hospitals. They don't have to wait for long times to be seen. And because I have this expertise, I can anticipate and find out the problem in the first consultation, which will be around 30 minutes to 45 minutes. It depends on the complexity of the situation. And I have a very good skills in ultrasound injections as well. So I can actually, patient can come, have the treatment done, inject it, become pain-free, and the end of the story, happy end of the story. So that's what I'm trying to achieve to relieve the burden on the hospital system here in Ireland.
How has the coronavirus pandemic affected your practice?
Well, actually, coronavirus affected all practices, and in chronic pain especially, because of the isolation, social distancing, and because of all these troubles, patients or people started to feel lonely. They are less mobilizing sometimes. They are not exercising as they are used to be. One of the major things in pain management is actual distraction. And when now in COVID scenario, patients are sitting in home all the time, they start to rehearsing the pain problems, thinking, and actually the pain problems become much worse now.
So what is your general advice for people who are in pain?
Well, I think for pain, we need to do few strategies, and this is actually can be found in my website. And I advise everyone, please, to go to the website and to subscribe to my YouTube channel as well, which is Chronic Pain Solutions. So they can actually find a lot of information. So knowledge and information is the first task to be achieved during this time. It is a time of learning and education. If they know what they are dealing with, actually they are going to deal with it in a better and much better way. Education, exercises, there are loads of exercises, stretches, and actually in my website, which is www.paintreatment.ie, I have loads of exercises there and educational materials for back pain, for neck pain, for hip pain, for muscle spasm, and so and so. So I think communicating with the person who is specialized is very, very important, and I know the waiting list in the public system is really, really long.
Have you been involved with research and the academic aspect of your field as well?
Well, actually, I am a very, very academic person indeed. So during my career, which is around 25 years in the field of anesthetics and chronic pain as a subspecialty, I have done lots of audits, lots of publications, and I think I have around 11 abstract publications in addition to presentations. Luckily, or I feel myself very lucky because of my expertise in ultrasound, I have done a lot of audits and research about how to use the ultrasound and how actually to get excellent results when you inject patients under ultrasound. I'll give you a little example. Knee injection, for example, it's a very simple injection. It can be done in many, many GP practices everywhere actually, but it doesn't work sometimes. And in my view, if the things are done under direct vision of ultrasound, it could hit the spot or not to hit the spot. So in my practice, everything I do under ultrasound guidance. So I can hit the spot and I test and I ask the patients, where is your pain? I examine him or her under ultrasound. And that's why my injection results is fabulous.
Tell me an incident that inspires you to work even harder in your field.
Actually, as a chronic pain consultant, when I was working in England, I had a patient and he is like one of really, really sincere patients. I always build a big rapport with my patients. It's not only that I am a doctor and he's a patient. No, I ask about the story behind the pain. Usually the pain has a story behind it. So that patient actually had a fracture in his ankle 30 years ago, had surgery to fix, like every fracture can be fixed by surgery. But this poor patient actually was not able to wear his socks for around 30 years. He is limping, he's using a walking stick, and he came to my clinic. I have done his injection, and after 3 weeks in the follow-up, actually I found a big flower box coming to my office in the hospital and a thank you letter. And after that, the patient came to visit me and he said to me, for first time in 30 years, I am able to wear my socks. So this was really rewarding, and that's something that I'm always proud with, the results that I achieve with injections, and the diagnosing is really, really good. So I'm not only doing injections, I'm actually mapping the pain. So I found where is the map, where is this pain coming from, and then actually I can target the area to do this injection.
I'll ask you a few more questions about yourself now, Dr. Mona. So, how do you find Ireland?
Oh, Ireland is a fascinating place. I love Ireland. I'm actually now living in Ireland for the last 14 years, and you know, the sceneries are just fantastic. Look around you. Look really nice. It's forest everywhere. It's nice sceneries everywhere. Irish people are very, very lovely people. They are social people. They like to, you know, to know each other. They are bonds. So it's very near to my home country in Egypt. And I think I get very well with my patients. The most important thing as well between the doctor and the patient relationship is to have this bond. And I have, for that reason, I'm always giving my patients actually I'm giving them my direct phone line number and the email address, so they can actually all the time contact me through the phone. If they have any trouble, they can email me and they found answer immediately. And this is something I'm proud of.
How do you compare the Irish health system to the UK health system and the one back home?
Yeah, actually there are a big difference among the three of them. So I will start with the Irish healthcare system. As we know, all healthcare systems are actually full and very busy. We know that it's the same scenario is repeating here in England and in Egypt as well. I believe that in the Irish healthcare system, patients are lovely, and this is for sure. In English healthcare system, there are more resources to do things, and this is something, it might, you know, take time to be done, but eventually the patient gets the service. And if we're talking about the healthcare system in Egypt, I think we need more kind of advancement in that system because, of course, lack of resources. So that's actually the local bus stop, which is just next to DF Medical Center. And I will take you now in a tour to Lucan Village, which is very near to this area, where I can do my daily exercise and where I actually can, you know, have my lunch sometimes. Exercise is really, really important for pain management. Here we are in Lucan Village. So, Hadi, I'm going to show you now the area. It's a lovely neighborhood. I come here very often, and indeed, I miss it really if I don't come to Lucan Village. It's very chilly today.
Yeah, it is indeed.
Yeah, do you agree?
Yeah, it's so cold.
Yeah, it is so cold. So
do you want to go grab a coffee?
Yeah, let's grab a coffee in a local coffee shop here. It's very popular, and it's good time to promote our local business as well.
Yeah, let's go.
Let's go. Well, Hadi, this is actually a new coffee shop here in Lucan Village, and it's called Numero 6. It's really tastes nice. I recommend people to come and try that coffee. Let's try some. Yeah?
Let's go have some coffee.
Let's go, please. Yeah. Hi, how are you? Hi, how are you? Yeah. So I really enjoy your coffee. So can we please have 3 flat whites and 1 hot chocolate? Yeah? Yes, please. Yeah. I really encourage everyone to try the coffee here because I really enjoy that type of coffee. It's really nice and have a very nice aroma as well.
Thank you very much.
Yeah, you're very welcome. You're very welcome. So how much I should pay you?
I'll tell you now. So 11.40.
Sure. Can I tap the card?
Yes, of course you can.
Yeah, okay.
So, as a doctor, what are your thoughts on the coronavirus?
I think actually going to hopefully to end soon with the emerging vaccines. But what I advise now is the virus is really getting weaker every time. It affects only mostly the vulnerable people. And I would really urge everyone to be staying healthy, eat well, and practice exercises as well all the time. Hadi, lunchtime is over now. Let's head back to the practice, to the DF Medical Center, and see my patients. Thank you so much for interviewing me today.
Thank you so much, Dr. Mona.
You're
It was
very-
really nice seeing you today. Let's
You're
go
very
back.
welcome, Hadi. You're very welcome. Pleasure. It was a pleasure.